It's Todd and Gunner here with Rattle Can Tactical. A lot of people don't know, he was a tunnel dog down on the Mexico border. I rescued him. Little fella, but he was good for going in and out of tunnels. He's probably tired of those earphones, so I'm gonna take them off. Roll Tide. Now, I'm gonna need you to lay down, son. I'm gonna need you to lay down. Okay, here it is, the reveal. We're gonna go over this medical bag. I'm gonna come out of this because I'm hot. Got a little bit of a rain delay on the range. Been burning a little powder. So here we go. If you'll sit down. Okay, we had to put Gunner up. He was a little obnoxious. Okay, here we are. As promised, the reveal. I'm gonna open this baby up. I'm gonna take this off. This contains airway stuff. Part of the ABCs, airway breathing, circulation. We got in the front, I usually keep gloves right here, but I used them this weekend. We were painting some rifles in Birmingham. Keep different kinds of tape, silk tape, cloth athletic tape, and some of the little cheap tapes like they put IVs in with. And then I just keep various different kinds of bandages, alcohol wipes, things like that, small band-aids, stuff like that. Lay that out there. That's the first bag. I keep a pair of scissors in here, surgical scissors, and I keep a skin marking pen in here. We've got tourniquets. I'll get to that. Keep a little pair of tweezers here, and I'll lay that there because I'm going to put some stuff out for you to see. That's pretty much all that's in there. Take this tourniquet. We'll go over that a little bit. So Army bag. I'm not in the Army anymore. I'm a retired combat medic. It was a 91 Alpha back then. It's called I believe a 68 Whiskey now. I was in Saudi Arabia. Went up to Kuwait. A little tour through Iraq right there on the corner. Just touched the corner a little bit. Roll Tide. So let's see what we got up here. This is just everyday. This is just stuff. Some Advil. I'm gonna lay this over here. Eye drops. Keep that. You could use that with tweezers. Cotton tip, little Q-tips, cotton tipped applicators. That can help with the eye. I keep a little headlight in here that stays charged all the time. If you were to find yourself in a situation, you were by yourself, you were alone on the side of the road, someone injured out here at the range, maybe just one other person than me, and it was nighttime. They do allow night shooting out here. You're gonna need both your hands, so we're gonna put some light on the subject. I keep Narcan in here. A little bit of a drug issue in this country, so I do keep Narcan in here. May save someone's life. And then I keep some saline, just normal saline in syringes. That makes for a good flush. Flush somebody's eyes with that. And then I keep a little Tylenol. Put that over here with the Advil. Pulse ox, I'll show you that later. So we're gonna zip this up. Zip that up. We're gonna unzip this. These are just 4x4s, little sterile 4x4s. They make a really good bandage, scrape knee. You put them around the chest tube if you have to. We don't have a chest tube in here. Remember, our goal is to get them to the hospital. ABCs. Nobody needs to see the 2 semesters I was pre-med right before I failed MCAT. So get them to somebody that's jacket says whatever their name is, him or her, and then it says MD or DO, something like that. That's what we need. Our goal is the emergency room, not the evening news, okay? So we'll sit these out of the way. Got a blood pressure cuff in here that I'll put with the old pulse oximeter over here. That may be out of view. Another assortment of band-aids I keep. These are odd band-aids for fingers, elbows, things like that. They're very useful. Sit them up there where you can see it in case you need to get some. The old Israeli bandage. This is a great bandage. We use these in the military. I've heard they've gotten away from it, but it's a great bandage. It's got a little place here. It's kind of sewn together on the front to put over an arm or a leg or something like that. I wouldn't suggest doing that. If you've got this bandage out, we're probably trying to stop bleeding, a pressure dressing, something like that. It's already got cotton in it. Put it on the wound. Come around. This is made, if you can see, this is made that once you come around the wound, you go back in here. You go back inside here. It's a little cumbersome with one. So you go back inside this, and then let's say that your cut is right here. Okay, you've got a cut right here. You're gonna pull this back over that cut. It's gonna add a little extra pressure. You can see there, a little extra pressure. and then we're just gonna go around, gonna wrap it up. We're gonna do some videos on how to use things like this. I just want you to know that and want you to see what's in the bag, and the purpose of having a dressing like this is that. So the Israeli bandage, I keep a lot of these. This is a really good dressing. I'll lay some of these out here for you. That's Israeli bandage. These are vacuum packed, so they're sterile, okay? And then I vacuum pack stuff myself to use in the pack. Here's some 6-inch Ace bandages. Here's a little smaller 4-inch that I bought, came with something I bought. And this is compressed gauze. Compressed gauze is really good. It's really useful for, if you get a gunshot wound, you know, you can get a gunshot wound up near the axilla, you can get a gunshot wound in the groin. You may not be able to get a tourniquet around an area like that to stop the bleeding. Wounds like that have to be packed. We'll go over that. Forceps also come in good for packing a wound, but gloved fingers work really good too, and you're usually in a hurry. So compact gauze, that's good. All first aid bags need that. And then I got, this is a vented chest seal, and this is a non-vented chest seal. They're made by Hyphen. I've got two. I keep two on here. I keep two in this pack. Back here's got two, a non-vented and a vented. If it's a puncture wound, it could just be one area is puncture, but it could be two. If it's a gunshot wound, there may be an exit wound. So you want to vent that, vent it. You can tape it off with silk tape. I keep duct tape in here too. Duct tape's better with a lot of bleeding out in the field. You remember, you're not in the emergency room. Our goal is to get them there. So duct tape, that's a great substitute for medical tape. And then you need to do a full assessment of the patient and see if there's an exit wound that's leaving the chest cavity. If there is, you need to seal it too. Try to reinflate that lung. So I'll put these up here, okay? And then, here's more Israeli bandages. These are slings, more 4x4s. Now, I've got some stuff, I'll show you that in a minute. More Israeli bandages. I'll set them over here on the rifle. And yet one more. I like that bandage. So these slings, let me tell you something. That's just 3 slings, vacuum packed, triangle slings. You can even use them for a tourniquet if you need to. But I've got one here packed separately with a splint. So this is a splint it's semi-rigid. You can straighten this out if you were to have a broken arm or for a compound fracture, and you put a pressure dressing, put an Israeli bandage on here, wrapped it up, had some sheet cotton, put some sheet cotton down, and then you can put this splint in place, wrap it with one of these 6-inch Ace bandages, tape it down, put the patient in a sling to kind of immobilize that arm. That prevents pain. You don't want a bone moving around a lot when it's fractured. And then get them to the ER. We got orthopedic docs, we got emergency room docs, and they can help them. They can do more for them than we can. All we need to do is get them to those guys. So just more surgical dressing. That's an ABD, big ABD. If you got a pressure dressing on, got a bad injury up here, maybe it's not penetrated the chest, just a bad injury, put a big ABD on it, tape it down, get them on the ambulance. That's what it's for. These, I'm not going to go over this. This is a specific type of tourniquet used in the operating room. I just keep them in here, but I'm not going to go over that with you. It has no use in the field. There's sheet cotton. That's sheet cotton. If I had a non-compound fracture, where the bone's not sticking through the skin, I'm not worried about bleeding, I would probably wrap that sheet cotton real heavy, keep from any more damage to the skin, just offer a little comfort, a little padded protection, and then I would put a sling on them, get them on the ambulance, send them to the MD guy or DO guy or girl. So I've got a little blanket in here. This is a safety blanket, heat blanket. They have uses if you know how to use them. We've got several cold packs in here. We'll put those cold packs out there for you to see. Got some more small stuff up here. This is bandages and things. Just bandages, Band-Aids, different things like that. Different size 2x2s, different size gauze. Some tongue depressors in here. I'll put these over here because I'm going to show you what's in that black bag in a minute. So I'm going to sit these tongue depressors here on top of the tape. Okay, here we go. This is what I'm looking for. This survival bag, is this is more of a survival bag. If you were to find yourself trapped somewhere, hiking, had a broke leg, it was cold, extreme temperature, this can be filled with leaves. You know, you put a good 12 to 18 inches of leaves in there, get you up off the ground. If it's cold, don't sleep on the ground will kill you. It pulls heat out of your body faster than anything in the woods will, other than maybe falling in a lake. It's being wet pulls heat out of your body. But you can fill this with leaves, you can get in it. It's green on the outside, silver on the inside, which is important. I'm gonna show you a blanket. You've all seen these. This is an emergency blanket for heat. And you wonder, I have, wondered how does that work for heat? It's paper thin. It's gold. The gold goes to the outside. The silver, shiny silver, goes inside towards the body. You shouldn't be able to see it once you wrap the patient in it. There's a reason for that. You see them a lot on TV. You see the silver and the person sitting there with the silver outside. That blanket's not working. The silver chrome shiny side goes towards the body. It reflects heat. So any body heat that person's putting off is reflected off this silver and trapped inside that blanket. It's trapped under them. Patients bleeding, patients in shock. You're gonna be losing body temperature. Patients that are wet, yourself, anybody else stuck out in the cold, you're gonna be losing body heat. Get a fire built if you know how to do that in the woods. We'll have videos on that. Then the gold side goes to the outside. Gold attracts the heat. It'll bring UV light to it. It'll bring that sunshine to it and attract it and heat that blanket up. And you got the silver, on the inside towards the patient. We got Rapid Fire over here. He thinks he's that guy. Maybe he watched Act of Valor. Who knows? A lot of people do that. You're not a Navy SEAL. No matter how many times you come here, baby, you're not gonna be DJ Shipley, Roll Tide. You're not gonna be him. You're not gonna be Cole Fackler, Jason Pike, Chad Wright. I've seen them all. I've learned a lot from those guys. You're not gonna be that guy. You went to Academy, you bought a gun, maybe you bought an AR-15 too, but the $500-600 model because you're doomsday prepping or you think the world's gonna blow up. Well, you bought somebody a rifle, okay? Because you don't train with it, you don't use it, and they're gonna kill you and take you away from you. They're gonna take it from you. That's what they're gonna do. It's gonna be sad. They're gonna say, he was a good guy. He just didn't ever train, he didn't know how to shoot his rifle, and somebody took it from him. That's what's gonna happen. Okay, anyway, enough of the foolishness. Let's talk about this, and let's talk about this. I'm gonna talk about this tourniquet, and then we're gonna move on to airway. I know airway's first, airway, breathing, circulation, but that bag is wrapped separately where I can put my hands on it fast without digging through anything. I can grab this, and I've got what I need to go to get an airway established. So that's the goal. I didn't tell you about this. This is just a little burn package. It's got different stuff in it, Silvadene, things like that. It's to help somebody that's been burned. It's a good little kit. Not real expensive. You can get them online. It's good to have to get him to the ER. This is all airway stuff, okay? Airway, breathing, circulation. Airway, breathing, need to check their breathing. That's in here too. Bleeding can also be B for me personally. So we've got a tourniquet. You got to stop them from bleeding. You got to establish an airway, and then you got to have circulation. You got to know their heart's beating. An AED is a good piece of equipment to have with you. I don't have one with me here today, but we've got one available. So we'll go over this in a minute. I'll show you how to use this. Is a Cat 1. I think it's about a 7th generation Cat 1 tourniquet. I keep it, when I get it, I take it out of the package. I prep them all this way. I've got them on my battle belts. I've got them on my plate carrier. So it's ready to go. When you put this on, if you're putting it on yourself, okay, don't put it on like this, where the strap's to the outside, okay? Because then you're pulling away from yourself. Put it on with the strap, the red strap facing you, where you can pull this thing tight, okay? Put it on somebody else. You're working on a patient. They're laying down here on their back. They're shot in this leg. They're up, supine, facing the ceiling. Put this on this way because you're not over their body. You're pulling this thing tight. Come around, you get this as tight as you can pull it with your hands. The goal's stopping bleeding. Don't worry about tissue damage. We're gonna worry about time. We're gonna mark the time on here. The doctors need to know that when they get to the ER, because that leg's been under anaerobic respiration. It's not being oxygenated. That's gonna create acid. And they need to know that. They've got drugs, sodium bicarb, things like that, they can administer to prevent that patient from washing out. When they take this tourniquet down, all that acid comes back into the body. You know, you can do a beautiful job, beautiful repair in the operating room and drop their blood pH to around 6.5, and you didn't do so good of a job. The old noodle can't take 6.5, baby. So here we go. Cat 1 tourniquet. What's important about it? As tight as you can get it. It's got this windlass in here. Take this, you just start cranking it until the bleeding stops. Keep cranking, it's painful, it's gonna hurt. Just keep cranking it. And then once it gets locked, you press it back in here where it won't unwind. You put this around, you take your Sharpie that we had in here, there's one in here too, every tourniquet I've got's got a Sharpie with it. Take your Sharpie, mark your time right here for the ER. For the guy with, what did we call it? MD, that's the goal. DO, MD, PA, somebody with way more knowledge than that 2 semesters I got before I failed MCAT. Roll Tide. That's what we need. Okay, on to airway. Airway's first on anybody you come up on, okay? If you come up on somebody that's unconscious, someone's fainted, you see the scene, you don't have any background information, you want to move that person as little as possible, but you've got to have an airway, because if they're not breathing, the ER is not going to do them any good if it takes too long. So keep a CPR mask in here. There's 2. There's one for an adult, and there's one for junior. We'll move some of this out of the way where you can see, where I can sit these things down as we go. And you can see what we got going on over here. So we got an adult CPR mask, tiny person CPR, rapid fire. Got a little CPR mask for a child or baby or infant, and we got one for an adult, okay? These little filters snap in here. These are one-way valves. Little one-way valves, that way spit up, spit, throat won't come back in your mouth. So we've got that. It's got a pair of gloves with it. And then it's got a little mask you can, there's the gloves. It's got a little mask in here too that you can put over the patient's face if you can't get this to work or for some reason you don't have that. And so we got that, got CPR masks. We've got an ambu bag, I forgot it. I had it out the other day. I was teaching a class and I left the ambu bag. So got an ambu bag you can put here, have someone assigned to pumping it at a rate you want. That helps. You know, CPR takes a while, it's stressful. So you clear that airway. You want to know, you want to open the mouth, you want to inspect the airway, because we've got other stuff here. We've got these J tubes. I'll put these where you can see these little J. These go in the mouth, just kind of hook in there, and they keep the tongue pressed forward to keep that airway open. They're they've got little vents here on the side where the air can go by. So that's what we got. I've got these, sit that there where you can see it. And I've got these all the way down to this size, little tiny infant size, little J airway. But the important thing, you know, it's important to know to clear that mouth first. You know, if somebody, dentures need to come out, okay? Just put them in a cup of water, take somebody's dentures out. They can choke on dentures, take them out of their mouth, look in there, you got a headlight, okay? Said that, I've got a pen light in here. Look in their mouth, visually inspect, see if you can see something. If there's a piece of food back there and you run up there and force this down in their mouth, this is rigid plastic. You may just push something further down into the airway that you can't get to. And that's gonna cause a bigger problem than you had before. So also got this. These are little nasal trumpets. They go in the nose, one side or the other. Look at the person and see if they've got a deviated septum. If they've had a broken nose, septum's deviated to the right, go in the left side. It's gonna be more open. All this, I've got jelly, KY jelly, lubricating jelly in here. It helps the passage through the nose or down through to get to the airway. You've got to get past the tongue with this down to where the airway's at. Same scenario, mask, bag them, that covers the nose. So we got these all the way down, 2 different sizes. So different sizes, little ones. So all that, here's one, that's another one, just came with a different pack, same thing, that's kind of an adult size. So there's another little J, but all of these are J tubes, all of these. So that's to establish your airway. So that's it, that's what I've got in this pack. I keep tourniquets, like I said, with everything. 3rd Army, that's the Army that Patton led. I was in the 3rd Army with the 47th Field Hospital out of Fort Sill, Oklahoma during Desert Shield, Desert Storm. And I'm not in the Army anymore. I'm old. I'm old, baby. Okay, I told you I would let you know what was in it. I did set these tongue depressors aside, and I did forget to mention that. You can use that airway-wise, it can help you. Don't go blindly sticking your hands down there. If you can see something in someone's mouth and you hold it up, if you've got forceps, you know, got something like this, I've got a little J grabber. It's important to not do stuff that you're not qualified to do because you're not covered for that. You know, if you've taken a first aid course or if you're just trying to help somebody, that's fine. You don't need to try to put a chest tube in on the side of the highway. If you got a security, if this is a bag and you've got a security team at church, I would find the people in my state, in my church that are licensed by that state. So there's things you can add to this. There's tracheal tubes, endotracheal tubes, ET tubes that blow up, laryngoscope. There's longer forceps to retrieve something, but that needs to be done by someone that's qualified to do it. And that person is probably not you or me or anybody else. So let's just stay within our guidelines, what we know how to do. Let's make sure we got an airway. Let's make sure they're breathing or stop the bleeding. And then let's make sure they got a heartbeat. And immediately, y'all know that if you've taken any first aid or CPR course, activate 911 immediately. Get the medical people on the way. That's the goal, is the ER. Okay, I'm Todd with Rattle Can Tactical. That was Gunner. Had to put Gunner back in the car. He was not cooperating, but he's cute. He's a good one. He loves to fish. I might include a picture. And he loves to sleep, eat mostly. So that's it. If you would go over to, that's it. If you would go over to Rattle Can Tactical on YouTube, it's at Rattle Can Tactical. Look us up, click on this video. If you saw the short, this is the video that goes with that short on the reveal. And if you would subscribe and click like, maybe share it with somebody. I would appreciate that. I'm trying to grow the channel and get it out there. So that's all I've got. Roll Tide.